It's the congressman's turn to investigate alleged irregularities in PhilHealth. A senator, meanwhile, is still after the agency's chief, saying the leadership may have turned a blind eye to corruption. The world is praying for Lebanon as authorities there probe the cause of the massive explosion in the capital, Beirut. And back here at home, another animal on the loose. This time, a piglet was spotted running on a flyover in Cebu City. Embattled PhilHealth officials face another grilling, this time at the House of Representatives. Lawmakers say the system of reimbursing hospitals is prone to corruption, but PhilHealth Chief Ricardo Morales defends it. Cian Arcangel monitored the hearing. She joins us live. Cian, what can you tell us?
PL lawmakers are urging PhilHealth to scrap its system of determining payouts to hospitals for COVID-19 cases and other illnesses. PhilHealth started implementing what it called the case rate system in 2013 instead of paying hospitals a certain fee per service rendered. The case rate pays healthcare providers a fixed rate based on illness or procedure. In coronavirus cases, payouts range from 44,000 pesos for mild pneumonia up to nearly 800,000 pesos for critical pneumonia. At the hearing of the House Public Accounts Committee, a Nakalusugan Party List Representative Mike Defensor blamed the case rate system for PhilHealth's loss of over 150 billion pesos from 2013 to 2018. Defensor says PhilHealth could lose up to 2.5 billion pesos if it continues the case rate system for coronavirus patients. But PhilHealth Chief Ricardo Morales says the case rate system works. House Minority Leader Benny Abante calls for a drastic move against the PhilHealth leadership.
Yung pong all-case rate policy na binabanggit ko sa inyo, General, kahit na anong gawin yung computerization, mako-computerize lang po ang corruption dyan sa loob ng PhilHealth. Dahil binabayaran ng buo based on a case rate, imbis na dun sa actual na ginastos ng isang pasyente, General.
If we will not be able to address the fraudulent claims, the corruption going on, the so-called mafia that is present there, I would even think, Mr. Chair, that truly PhilHealth ought to be dissolved and the name must be changed, and the people that are officers of PhilHealth right now should resign and be replaced by others who can do the job.
Ang logic kasi sa case rate, meron tinatawag na meron hong nagbabayad, gumagastos sa hospital na mas mataas sa case rate, meron din hong nagagastos na mas mababa sa case rate. Kaya overall ang wisdom ng case rate ay dapat papantayo siya on average sa gastos.
Morales says loopholes in the case rate system will be fixed once PhilHealth shifts to a system of allocating a specific amount to each healthcare provider, and it will be up to the management to determine how funds will be spent. Yeah?
Cian, PhilHealth's acting senior vice president revealed yesterday that the reserve funds are going to run out by next year because of the pandemic. Was this raised during the House hearing?
Yes, Pia, that issue was raised during the House hearing, and Marikina Representative Stella Kimbo is asking PhilHealth to submit a third-party assessment about the status of their reserve fund. She says that it is highly unlikely for PhilHealth reserve funds to run out by the end of 2021, considering that the state health insurer will still be able to collect from its members and from employers and still be given government subsidies next year. So she's asking PhilHealth to assess the state of its funds and submit a report to Congress. Yeah?
Cian Arcangel there reporting. Senator Ping Lacson believes PhilHealth President Ricardo Morales may have been, quote, co-opted or involved in massive corruption in the government corporation. Lacson adds he has enough proof that a number of PhilHealth officials committed graft and corruption. Meanwhile, Senate President Tito Soto says the Senate is willing to help give PhilHealth more money to avoid bankruptcy, but it should first clean up its ranks. Joyce Ilas joins us on the phone for this report. Go ahead, Joyce.
Pia, unresponsive or evasive. That is how Senator Ping Lacson described the behavior of PhilHealth President Ricardo Morales and other PhilHealth officials when they appeared before the Senate on Tuesday. Lacson, Vice Chairman of the Senate Committee of the Whole, says he believes that Morales have been co-opted by other PhilHealth officials to get him involved in the massive corruption in the agency. But for Senate President Tito Soto, he is willing to give Morales another chance when the Senate probe resumes next week. He thinks Morales is either protecting the other PhilHealth officials or being blindsided by them. Both senators, however, agree that other PhilHealth officials committed graft and corruption. Lacson even went on to say he has enough evidence against these officials. Lacson also reveals that one of the supposed witnesses in the hearing, Morales' head executive assistant Etrobal Laborte, backed out due to a threat to his life. Meanwhile, Soto and Lacson say the Senate is willing to help give PhilHealth additional funds to keep it afloat, but on one condition. PhilHealth still needs to clean its ranks first. A PhilHealth official said on Tuesday that the agency is running out of reserve funds next year and may stop operations in 2022 due to low collection and increase in payouts because of the pandemic. But Senate President pro tempore Ralph Recto believes otherwise. During the hearing, Recto claims PhilHealth still has enough earnings or reserve funds to help keep it afloat. Pia?
Joyce Ilaster reporting. The health department says government is maximizing the 2-week timeout for the health system to add more health workers, find and crush clusters of infection, and recalibrate strategies to a health-focused approach. These include coming up with better guidance on the use of rapid antibody test kits and the management of cases in communities and industries. Let's bring in our correspondent, Carolyn Bonkin. Carolyn, what changes exactly are you looking at and expecting?
Well, there are two things here. The Health Department and the Medical Society agree on the need to actively find cases and eliminate clusters in the next 2 weeks. They need to identify areas of infection, isolate them from each other to avoid further outbreaks. Health officials also point out there will be systematic screening in communities. People in high-risk areas will undergo COVID-19 symptom check. Also, officials want people to better understand and use COVID tests. Health spokesperson Maria Rosario Vergeres said earlier, rapid antibody test kit should not be used as an assessment tool. RT-PCR, which is the swab test that detects the virus, is the gold standard. The medical community has been saying the same thing since April, asking companies not to use this as basis to allow workers to return to work. They said antibody tests can lead to false negative or false positive result.
Yung testing po is ginagamit na lang po natin pag meron na po tayong kaso sa loob ng ating company and we want to establish kung meron pong kumakalat na infection. So what is very important po is for companies to develop po a plan that will re-engineer the business processes so that the interaction between people will be minimized and the chain of transmission within the workplace can be addressed.
Well, what we know so far, the Medical Society will use this 14 days to come up with operational plans to help different industries ensure workplace safety amid the pandemic. The Health Department is also issuing guidelines on the use of the different types of tests. Pia.
Carolyn, Yusek Vergeire earlier said they're going to be on the ground this time around and they're going to visit the localities. For the Health Department, how will this lead to a better management of cases?
Well, officials have been saying that a whole-of-nation approach is needed to fight the pandemic. This includes engaging and better informing communities, not just the residents about wearing masks, but they need to zero in at the barangay response. There are still instances wherein barangay health workers, for example, still don't know whether they'll do the contact tracing or if they should wait for the DILG or the DOH perhaps. Further education and training is just one. The Health Department also promises a more detailed data showing the number of cases per barangay, which will also help manage cases.
We are going to go on the ground. We are going to go at the local government units at the local level, where we would want that the people would feel that DOH is there. We would like to make people feel and see that DOH is leading this response.
Well, as of today, there are 47,500 active cases. That's 41% of the total coronavirus cases in the country. New infections today are mostly from Metro Manila and provinces in Calabarzon. Former Health Secretary Manuel Dairit says this is what the country should look at, because the active and new cases will tell us where we should give more focus on the response. Pia.
Carolyn Bonkin there reporting. Prices of basic goods and services rose even faster in July amid a spike in transportation costs. The Statistics Authority logged inflation at 2.7% last month, up from 2.5% in June. PSA says tricycle fares doubled in July compared to the same month a year ago. Physical distancing measures forced drivers to hike fares to cover the costs. There were also double-digit increases in air and boat fares. Prices of LPG, rent for houses, and water bill costs also went up, but food prices remained stable. The economy shrank wider than reported in the first quarter. The Statistics Agency revises the figure to a 0.7% contraction in January to March, worse than the 0.2% slide reported in May. Latest economic growth numbers are expected to be released tomorrow. Presidential spokesperson Harry Roque earlier said the economy can no longer afford an extended lockdown. Metro Manila, Bulacan, Laguna, Cavite, and Rizal are back under a modified, enhanced community quarantine until August 18 to curb the surge in COVID-19 infections. Coming up on Newsnight, the latest in Lebanon following the horrifying twin blasts in its capital city, Beirut. CNN's Ben Wiedemann will give us an update live from that city. And how is the Philippine government helping Filipinos there affected by the explosion? Details after this short break. Lebanon scrambles to deal with the aftermath of a massive explosion that sent a shockwave across its capital, Beirut. At least 100 people are confirmed dead and thousands more are injured. As officials assess the damage and probe the cause of the blaze, these figures are expected to rise with search and rescue operations ongoing. The blast comes as Lebanon grapples with a crumbling economy amid the COVID-19 pandemic. CNN senior international correspondent Ben Wiedemann now joins us live from Beirut. Ben is going to be joining us in just a bit. Ben, of course, was saying much earlier that he had been covering several wars in Lebanon, and this is a completely different scenario for him. We're going to go back to Ben Wiedemann in just a bit. In the meantime, all right, we have Ben Wiedemann right now with us. Ben, you said that you'd never seen anything like this and that you've covered many wars in Lebanon. Can you describe to us the sounds, the colors, the visuals of the fear that gripped Beirut the moment the explosions happened?
Yeah, I mean, Lebanon has seen a 15-year civil war, several wars with Israel, 1982, 1996, 2006. But just in terms of that one explosion that felt like nothing else I've ever felt. It was like an earthquake. Nobody has seen that. I mean, you've seen bombs fall, artillery rain down on parts of Beirut. But in terms of just one single explosion causing so much damage. Now, we're in an area called Gemezi, which is an area of bars and restaurants, and most of the glass has been shattered. They're trying to clean up, trying to make sense of all of this. the government is offering, trying to put together funds to try to help people rebuild their lives. But of course, the problem is Lebanon is bankrupt at this point. The local currency has lost 80% of its value. The Lebanese economy has entered hyperinflation territory, and therefore the wherewithal to rebuild Beirut after this incredibly destructive explosion yesterday may be hard to come by.
Ben, do we already know at this point who's going to be held responsible for this? Who's going to be accountable? So many people injured that hospitals, we heard, had to turn some of the injured away. But can they still get medical attention? Earlier today, we spoke to a Filipina national who lives there, and she was injured, but she said she decided not to go to the hospital anymore.
The problem is that the hospitals last night were overwhelmed with people coming in. In fact, our producer, Ghazi Balkiz, who's a veteran of covering the Iraq War, the Syrian War, he had to go to the hospital, and he said it was worse than any scene he'd ever seen in Iraq or Syria. And so many people who were not too seriously injured just patched themselves up. Some people went to pharmacies just to get a small bandage put on and have their wound taken care of. So people just realized that the hospitals were dealing with hundreds of people all of a sudden. And these are hospitals that are already suffering from shortages of medicine and supplies because of the economic crisis. In terms of who's going to be held responsible, well, we'll have to wait and see, because according to multiple Lebanese officials, there were 2,750 tons of highly explosive ammonium nitrate in the warehouse in Beirut port that exploded yesterday. Now, apparently they had been seized from a ship back in 2013, 2014, and just left there. Now, the question is, was it merely incompetence? Was it corruption? Was it something else? The Lebanese authorities have given themselves 5 days to get to the bottom, to investigate why that dangerous ammonium nitrate was there, what caused the explosion, and who simply forgot about it or ignored it or neglected it. So there's a lot of pressure on the government to explain what on earth was behind this decision to leave this highly dangerous material in the port of Beirut. And I must stress, the port of Beirut is right in the middle of the city. We're less than a kilometer away from there. And for 2,750 tons of a highly explosive chemical compound to be kept in the middle of this crowded city is beyond the comprehension of most people.
This is such a horrific incident, and for this to happen at a time like this, Ben Wiedemann, many thanks for spending time with us here on CNN Philippines. Hospitals in Beirut were bursting at the seams with victims of the explosion, and they've had to turn away people. So some of the wounded decided to self-medicate and give themselves or seek first aid from others. Among them, this Filipina overseas worker. Her name is Ursula Gila. Some 12 hours after the explosion, she still had glass shards in her face and on her arms, as she spoke to our Pinky Web earlier today.
Pagbukas mo ng pinto, puro bintana siya. So pagbukas ko, may sumabog, nakita ko yung puting usok, lumapit ako sa bintana, binuksan ko siya para tingnan kung ano yon. Pagbukas ko, sumunod na agad yung kulay itim na usok na yon. Doon na ako napalipad, napatalapon, doon na, hindi ko na alam kung ano yung sunod nangyari. Basta alam ko, bumagsak ako sa sahig. Tumayo ako, doon ko na nakita na tumutulo na yung dugo ko, marami ng dugo sa sahig na umaagos, hinibo ko yung mukha ko, puro dugo pala ko. Wala akong naramdaman kasi nung oras na yun Nagpunta ako ng ospital, punong-punong ospital, talagang grabe, ang daming sugatan talaga. So ang ginawa ko na lang is umuwi na lang ako, na isip ko na sa bahay na lang ako na lang gagamot sa sarili ko dahil talagang mas marami pang mas malalang sugatan kaysa sa akin. Talagang hindi ka na mapapansin. So umuwi na lang ako.
Foreign Secretary Teddy Boy Locsin says the Philippine Embassy in Beirut is now taking care of Gila. The DFA says 12 Filipinos are still missing after the massive explosion in Beirut. 2 Filipinos are dead while 8 others are injured in the blast. The agency is working with Lebanese officials to fast-track the return of OFWs. Our Tristan Odalo joins us live for more on this, Tristan.
The Foreign Affairs Department or the government are closely working with their Beirut counterparts to assist Filipino nationals affected by the explosions in Lebanon. The government says that there are over 31,000 Filipinos in Lebanon, mostly household workers. Even before the blast, a repatriation program has been in place for Filipinos affected by the COVID-19 pandemic. In fact, around 230 Filipinos may be brought home this weekend or later this week.
Yung mga handa na pong umalis or handa na pong umuwi, papauwiin na po natin sila. At yung mga maiiwan po, gagawin po natin lahat ng ating makakaya para mapauwi po sila. It's the same, but of course, ngayon, because of what happened, we see na we have to fast track the repatriation, especially also the shipment of remains. And yung mga kababayan natin na kailangan din po ng medical repatriation, kung kaya namin isabay sila sa repatriation na ito, gagawin rin po namin.
The government says that they are now coordinating with the families of the victims of the blast. And then search operations also continue for at least 11 missing Filipino seafarers whose ship was docked near the port area or a few meters away from the port area where the blast took place. Tia.
So what are the challenges in bringing our OFWs back home?
Apart from the restrictions brought by the COVID-19 pandemic or the limitations brought by the COVID-19 pandemic, he says the Filipinos need to secure exit visas before they can leave Lebanon. So this is something that they're currently looking into and how they can fast track this process so that they can bring home Filipinos who want to go back to the country. Also, there are also issues of human trafficking and then those undocumented Filipinos that they have yet to coordinate with. Yeah.